and then we will follow with our 3 partner presentations, our breakout room session, follow-up reports on each room, and then some final Q&A. So now it is my honor and privilege to introduce our DAISY co-founder, Bonnie Barnes, who is here to welcome us all here today. Welcome, Bonnie.
Well, it's my honor and privilege to be with all of you. We could not be more proud of the relationships we have built in Michigan and of your dedication to bringing truly meaningful recognition to your nurses. You all do such a beautiful job with our program, and I'm very excited to see not only the 3 who are showcased today, but also to hear from you what you're doing and how you're doing, and hear your questions and see what we can do to be serving you as best as we can. DAISY is now in over 5,800 healthcare facilities, not only in the US, but also in 36 other countries. As Alex alluded to, she runs most of them for us. It is just amazing to our family to see this running around the world as it is, as meaningful recognition is taking on greater and greater stature within the concept of a healthy work environment. But you all know that because you are the people who make it happen every day. And I often say that DAISY doesn't happen by us sitting in our home offices, sending you emails and creating materials for you. What it really happens is by what you do every day to bring it to life in your organizations, to express gratitude from your leadership, as well as and especially from your patients and families who we know want to say thank you to your nurses. There are more than 2.5 million nominations have been written for the DAISY Award so far. So clearly we're not the only family that needs to say thank you to you. And on behalf of all of our team who are our extended family, I welcome you to this event. I know it's going to be really meaningful for all of us to learn from each other and for you all to get to know each other. Thank you, Janet, for inviting me.
Thank you so much, Bonnie, for being here with us. It's always a joy to see you.
Thank you.
So let's get started with our presentations. We have 3 fantastic presentations for you today. The first one is going to be coming to us from Sparrow Clinton Hospital. And I'm going to share my screen here. There we go. I would like to introduce Mariah Hess. She is the Chief Nursing Officer and DAISY Coordinator for Sparrow Clinton Hospital. Welcome, Mariah.
Thank you, Janet. Appreciate attending today. As Janet stated, my name's Mariah. I've been the DAISY Coordinator for about 2.5 years now. Prior to that, though, I've been involved in the DAISY celebrations as the Director of Patient Care Services, and just recently transitioned to Chief Nursing Officer. What we started, you go ahead and next page, we started our partnership with DAISY in 2015. We are a small critical access hospital, 25-bed inpatient unit. We have about 13,000 ED visits a year, so we're very small. We have a total of, counting our leadership and our office practice nurses, we have 74 registered nurses at this time at our facility. And so we can go ahead and to the next page. We have, since 2015, we hold our DAISY celebrations twice a year. And since 2015, we've had 215 nominations, and 98 to 99% of those nominations all come from patients and families, which is amazing to hear these stories. We've had 15 DAISY honorees, and over the last few years, we added the Team DAISY, and then a year and a half ago, we added the Lifetime Achievement Honor Award for one of our nurses that was going to be retiring. She was our Chief Nursing Officer, and then had transitioned to our president of our hospital, and she had 42 years in nursing, and it was a great celebration. We have our celebrations. You can see we have daisies for every nominee, and we display all of the wonderful gifts that the honoree receives. If you could go ahead to the next page, please. Our DAISY committee consists of direct care nurses from each of the nursing departments. And then we also have 2 of our retired nurses that were on our initial DAISY committee back in 2015. One of them was one of our nurse leaders that was the DAISY coordinator. She had served 39 years at Sparrow Clinton Hospital and was the DAISY coordinator back in 2015. When she retired, she wanted to continue on as being part of the DAISY committee, and we were happy to have her involved. And she attends every meeting, along with one of our nurses that retired 41 years ago, all from Sparrow Clinton. She was one of our LPNs, and she is also on the committee and does not miss a meeting. So it is great to have them be part of our committee. We meet twice. We have biannual meetings, and we touch base with each other on a quarterly basis as well. It is all blind voting, and the committee developed a criteria scoring sheet. As you can see here, some of the scoring that they look for is one who goes above and beyond of care for patient family, role model behavior, professionalism, contributes to the healthy work environment, positive attitude, and advocates for the patient care needs. So they keep track, they keep notes, they give the points are awarded, and then we do look at the top 3, and then if there's ties, we go ahead and reread those stories and nominations again, and the nurses discuss the reasoning behind maybe one more than the other if there was a tie. Next slide, please. We have our DAISY nominations. We have it online on our system website page. We also have on the back of the brochures, the QR scans, barcode scans. We have paper nomination forms, boxes in our waiting rooms, lobbies. Also, our ambulatory surgery, they put them in their discharge folders. We have information about DAISY on our patient communication on the whiteboards as well. COVID, during the pandemic, we did have a lapse in celebrating in our cafeteria or our conference room, and we did end up going to the units. And so in that one picture there, you see us holding a phone. We had the family that nominated this nurse, Lisa. Actually, we Zoomed with her because we do invite families and patients to our celebrations. The next slide, please. So prior to the DAISY, we coordinate schedules with managers and nominees. We send out individual invites. We order our cinnamon rolls, our flowers. We invite patients and families. So the honoree, we do try to reach out to their families to see if they're available to come to the celebration. And then also we invite the patient or family who has nominated the nurse to attend as well. All the nominations are invited to the celebration, and so it is a big surprise. No one is aware of who's going to get the honor of the DAISY Award. We, all staff are invited to attend, house-wide, hospital-wide. All nominees receive their nomination pin, and they also receive a handwritten thank you note from the CNO. And the card is hand-painted DAISY by one of our retired nurses, actually the one that is on the DAISY committee, our LPN, she's pictured there. She had 41 years of service, and actually when she won the DAISY Award, we blew up her thank you hand-painted note and had a little message there for her and had it framed. So she hand-paints those daisies and thank you notes for us for the CNO to write in. And then our post-celebration, the DAISY honorees recognized on our website, social media, external, internal, and then also our DAISY banner is hung on the unit. Next slide, please. We have, as I mentioned, implemented the team award. And during COVID, we did go outside for pictures so we could take some masks off. And our infusion center received one of the first team awards, along with the next one was our emergency department. As you can see, we have family members there as well for their great efforts. And then our Lifetime Achievement Award did go to our chief nursing officer and then transitioned to President Beth Doherty. And you can see that was a great celebration. We really made it individualized and recognized the lifetime achievement. We had, we asked leaders that all nurse manager leaders, management and her colleagues from in the past, board members, other executive team members, frontline staff to write a message or a note or share a picture. And we put together a book and gave that to her at her celebration. So we try to make it very personable, very celebratory, and everyone is invited to enjoy the celebration. You know, with a limited number of nurses, with 74, we have only had one Daisy awardee, honoree, receive the award twice. We try very hard to make sure that does not happen. So for example, when I mentioned that if there's a tie and they're really torn between two different stories, two different nominations, the committee will say, has one of the nominations received the award before? And then, they will opt to give it to the other nurse. However, if there is a clear, that one story is the absolute best in that time frame, that will occur. And that has only occurred once since 2015. But we are very pleased for the size of our facility to have received that many nominations, and for those nominations to come from patients and families. It is very heartfelt. So no matter your small, medium-sized, large hospital facility, it definitely is a great celebration and recognition for nurses. So thank you.
Wonderful. Thank you so much, Mariah, for sharing your program with us and your best practices. And you're small but mighty, I can attest to that. So thank you so much for being here with us today. Next, we have a presentation from Madeline Tarakis, and she is the magnet coordinator for Henry Ford Hospital in Detroit, and she's also the DAISY coordinator. So Madeline, please share with us your DAISY best practices.
I am trying to, and all of a sudden my computer does not want to share. So one moment, I apologize. You have to love and hate technology all at the same time.
Let me know if you need me to open it.
I had it open, and that's the funny thing. I've got it open, ready to go, and it doesn't want to cooperate. So one moment, please. Oh my. I'm so sorry. Why is it being so stubborn? Okay. All right, let me try one more thing. I'm so sorry, everyone. All right, I'm going to try this again. Okay, Janet, it does not want to cooperate for me for some reason today.
Okay, let me pull it up.
Thank you. I apologize.
It's okay.
Oh, best laid plans.
Gosh, Madeline, this has never happened to anybody. I don't know how.
Really?
I know. As long as we've been in this whole virtual world with COVID, it always makes me laugh when someone's like, I can't get off mute. I can't do this. And like, we've been doing this for so long, we should be just tech savvy, and we just still, it stumps us. So it's just
I don't think it's you. I think it's it.
It's gremlins.
Absolutely, there are lots of computer gremlins.
Definitely. Bear with me. It's coming.
Okay.
That's what we call our Christina her brilliancy. But she can solve anything.
Definitely.
No pressure.
Right, exactly. Okay, I can share this.
Good.
And Madeline, just tell me when you want me to advance the screen.
All right. Thank you, Janet. You saved me again. Not the first time. That's for sure. All righty. So after all that fuss, okay, so I'm Madeline Tarakis. I'm the DAISY coordinator here at Henry Ford Hospital in Detroit. You can go ahead, Janet. So we are a 877 bed hospital in Midtown Detroit. So a little bit bigger than Sparrow Clinton is, certainly. I started here as in 2013. And one of the first things that I said we had to put in place was the DAISY program. We had not had any real good formal recognition program here until then. And we started it in 2014. And when we first started the program, lots of enthusiasm around it. We received, about 100 nominations, and we thought, okay, this is great. This will die off after a few times. We won't see this many nominations every month. And to our surprise, we were seeing 100 nominations on a monthly basis. So now we receive anywhere from 75 to 175 nominations a month. And so we've been able to recognize over 2,500 of our nurses as a result. And of course, the best thing is we know those, all of you that are doing DAISY, it's so wonderful when you get those nominations from patients and families. So we're seeing, at least 98% of those coming from families. Sometimes a staff member will write something because the family couldn't, and they saw something that occurred, but the family member didn't have the ability to write that nomination, but a staff member saw it and nominated a colleague. So it's always wonderful. We've recognized 100 DAISY honorees in that time since 2014. Okay, you can go ahead, Janet. So how do we collect our nominations? We get them in various ways as everybody tries to put the word out as best as possible. So we have a formal hard copy nomination form. It's a card stock, and it is actually a perforated. So the nomination is written, and the person that's writing the nomination can keep that front page, and it talks about the DAISY program in there. And then we use the nomination boxes, so then they can drop their nomination boxes in there, or they can give them to the nurse, they can give them to the unit secretary, whatever. A lot of the unit secretaries place those nomination forms in the patient's experience binder or folder when they are admitted. And so that they're there. A lot of times the managers, when they're doing leadership rounds, they will have a stack with them, and they'll say, if anybody has been outstanding that you'd like to recognize, here's a nomination form. We also have the ability to collect nominations from our henryford.com website. There's a link right there that they can access. Patients and families can access it and make nominations that way. We also just found out that through our Epic My Chart, there's now a drop down there, and anybody can make a nomination from Epic. They can just click that link and it'll take them directly to that henryford.com site, and that'll give them that option. We also now just got approval to embed a QR code onto our Press Ganey surveys. So there'll be lots of ways, in addition to what we have already, for nominations to come to us. So that's really exciting. Go ahead, Janet. So what happens when we get all these nominations every month? You have to have some sort of a way to log them in, because it's too hard to keep track of them otherwise. And all of you that are doing this realize that you have to kind of keep track somehow. So there's one of our administrative assistants who has really taken this on, and she does a wonderful job. She takes all of those nominations every month, and at the end of each month, she collects them all. They either turn them into her, they turn them into me, and then she goes through and she logs them all in. She makes sure that she captures credentials and indicates whether that nomination came from a patient, a family, or a staff member. This is kind of a nice way for us to keep tabs on the percentages. And then the spreadsheet keeps growing every month. And it's a nice way for us to make sure that we are up to date. We know who's getting nominated, how many times they're getting nominated. And we started our program at in July when we did start it. And we decided at that time that we would do a 5 nomination pin for anybody that received 5 nominations within each, not within 1 month, but 5 different nomination months. Is that if that makes sense? Because you can see it even on that, you know, sometimes somebody gets 5 or 6 nominations in a month. We wanted to make sure that from July through the following end of June, that anybody that is has received 5 separate nominations is recognized that way. And so this spreadsheet really helps us to do that. So we can go back and look. Okay, you can go on. So what's our process like? So as I mentioned, all of those nominations come to us at the end of the month. Connie then logs them into that Excel spreadsheet. So once she does all of that, then she gives me all of the hard copy nominations, even the ones that are submitted through the website. They populate into an Outlook mailbox that I receive, and she also receives, so we can print those off. And then I'll go through them all, I'll vet them all and eliminate the nominations that are nice and somebody took time to nominate a nurse, but might not have a lot of good meat to it. We want to make sure that, you know, we have a really great story to wrap our arms around. So I'll sort them all out that way. And then, you know, out of that 100, we may end up with 20 or 25 of them that then we will look at more critically. All those nominations go to our Nursing Excellence Council. They're part of our shared governance structure, and they review all of the nominations. We take out all identifiers if possible, and that way making it, you know, blinded review for everyone. And then what we do at that point is we'll select that nomination for the next month to be recognized. So this is April right now. So at the end of March, we collected all of the nominations that came to us through March. We had them all sorted. We will review them at our meeting next week, as a matter of fact, and then we'll make a selection, and that person will be recognized in May. So there's a little bit of a lag time, but that's the only way it really works for us, because we have such a volume, we have to be able to spread it out that way. So, okay, Janet. So this is our score sheet that we developed. Our criteria is on here, of course, and we'll go through and we'll score each of the nominations, and then we'll read out loud the top 3 or 4 of them. And as a group, we'll make a decision as to which one we want to choose. And like Mariah was saying, sometimes you have a bit of a tie, or you kind of vacillate back and forth. We also made a decision at the very beginning that we would not recognize the same nurse twice. We have so many nurses here that there really isn't a reason that we'd have to recognize the same person twice, because we have so many great nurses. I know sometimes those stories that come in from these nurses that are already stellar are just, you know, they just tug at your heart so much because they're so wonderful. But we also know that that's why they get those nominations. Is because they're such a great nurse. So we'd like to make sure that we spread the wealth around. So we'll use this score sheet to help us be able to do that. And then we'll have a little dialogue about who we think is the best candidate for the recognition. You can go ahead. So then we do a monthly celebration. We keep it a surprise if at all possible. I think a couple of times we've had to spill the beans, but it's really fun to keep it a surprise. We set up shop on the unit. We used to do it in our large auditorium, and we found that just going up to the unit was better. We had more engagement that way. And so that center picture, you could see she really was surprised. She had no idea. She was nominated by a patient who actually was able to come in on the Zoom call. So she was really, really touched. We used to have our patients coming in. We used to have family members coming in. Of course, all that stopped with COVID. We continued our ceremony even through COVID. We said, this is one thing we're going to keep doing regardless. So we kept at it, but we started doing all Zoom for patients and families to join in. And that's been really actually a lot of fun. And it's actually easier because you don't have to worry about the logistics. And, you know, we'll do this at change of shift. It's at 7 in the morning. And it's really hard for family members to come in that early or patients to come in that early. So the Zoom option has been great. And so and then we make that a surprise too. And we're holding up a laptop and we're covering up everybody's pictures with sticky notes so the person can't see who it is. It's a lot of fun. Janet likes to join us on those when she can as well. So it's awesome. And we have a big pull-up banner that stays up on the unit for the month. Their picture goes up on that banner. And then at the end of the month, when we take it down to take it to another unit, they get to keep that picture. We also have a photographer that's with us They take all kinds of pictures at the ceremony. I share that gallery with the recipient and the leadership team on the unit, and they can download any pictures that they want to. Our chief nursing officer is almost always at this event. This is her favorite time of the month to be there. Sometimes she has a conflict, and it's heartbreaking for her because she'd rather be here celebrating Daisy than on some system-wide meeting or something like that she feels is always painful. I can understand. So this is a better place to be. You can go ahead, Janet. After we've taken all those pictures, I then take a group picture and I embed it in a slide that then is sent to the unit, and they can put this on their electronic huddle board. And it's just a nice way for them to be recognized upon the unit as well. You can go ahead. Each of our nurses that does receive a nomination will receive a specific certificate that we kind of customized it a little and made it into a nomination certificate. So they get a nomination certificate and a pin. And then I also send this slide for their electronic huddle board that says, here are all the people that received a nomination from your unit each month. So again, it's a nice way for that continued public recognition. Go ahead. And this is the nomination certificate that we have. And then our chief nursing officer signs these, and it's always really special for them because we decided again from the beginning that everyone would get a certificate, everyone would get a pin, because the person that took a moment to nominate them did so for a reason. So we felt that they deserve that recognition. Go ahead. We've also incorporated our Daisy Nurse Leader and Daisy Team Awards. We didn't start those right away. We started those a little bit later, but we've done 6 Daisy Nurse Leader Awards. We now just moved to doing that twice a year. So we'll do one during Nurses Week, and then we do one at the end of the year. And so again, these nominations, we have an electronic version of a nomination that anybody can nominate a leader for, and we have criteria who those leaders are. And so we receive those nominations in, and then again, it's always a difficult task to make that selection for the Daisy Nurse Leader, but it's quite an honor, of course. And then we've done 4 Daisy Team Awards so far. So we do that during Nurses Week as well. And again, this is always a great opportunity. We were able to use one of our, our last magnet, our first magnet go around, and we were doing our redesignation now. We were able to use our Daisy Team Awards as examples in our magnet documents. So that's really exciting. You can go ahead. And that's it for me. If you have any questions, it's my contact information. You can always reach out to me. So thank you so much for the opportunity to share what we do here at Henry Ford Hospital. And thank you for saving me, Janet.
Anytime, Madeline. Thank you so much for sharing what you do at Henry Ford to make Daisy wonderful. Our third presenter today is from Michigan Medicine, University of Michigan Hospitals, and Mott Children's Hospital. Gail York is the nurse recruiter there, as well as the Daisy coordinator. So she's going to share with us a little bit about how her program works. So Gail, welcome. And let me know if you have any issues with your sharing.
All righty, so let's see what I've got here. All right, can everybody see my screen? Yes?
Yes.
Okay, great. Okay. Well, thank you for inviting me to present information on how Michigan Medicine selects our Daisy honorees and the whole entire process. So I appreciate that. My name is Gail York. I'm a registered nurse. I've been a nurse for over 35 years, and I've been at Michigan Medicine about 12 years. I am a nurse recruiter, and we're a little bit different than other hospitals. We do a retention side of my job, and the Daisy program falls into that. Well, let's see here.
Yeah, we're seeing the Janet
Yeah.
slides.
Right. Oh, I shared the wrong thing. Hold on. A new share. I picked the wrong one. Oh, let's see. Where is my presentation? Wow, I think I have the little demon that Madeline had.
Tell you, it's a little gremlin for sure.
Do you want me to pull it
Yeah,
up?
yeah, would you please? I don't want to waste people's time.
Sure.
I don't know what happened to it. That's crazy.
Just go ahead and stop share.
All right. Oh, that's really strange. Thanks for saving me too, Janet.
We
I
know
always
that
tell-
anything goes with these
I know it.
sessions.
And I always tell my team, I know just enough to be dangerous. So
I hear you. Okay, here you go.
And
I
then.
think Janet needs a pay raise. I'm just saying.
yeah. So you want to go to the next one. So a little bit about our DAISY program history.
So like, Jenna said we used to like Tennessee.
Getting a little bit of feedback from someone there. Thank you. So the program here at Michigan was launched in 2007. It has always been sponsored by a dear lady, Charmin Lampka. She was, her husband was a patient at U of M and received exceptional care. And she wanted to bring the DAISY program to honor our nurses. And actually her husband, nurse, was the first DAISY recipient at U of M. So since then, she's been a awesome sponsor and cheerleader for our program, and we really appreciate her. And sometimes she's able to come to some of the awards. So I took over the DAISY program probably about 8 or 9 years ago. I kind of lost track. And at that time, we weren't doing a lot with it. We weren't getting a lot of nominations, and we weren't doing, we were not having monthly awards, but we were, when we got a solid nomination for a letter, then we would have the award. So when I took over, I started really trying to figure out how can we get more nominations? How can we have an award ceremony every month? So in 2015, around there, 2015, 2016, sometime, I started looking at putting it online and really doing a campaign. And then in 2019, Charmin so graciously offered to support 2 DAISY Award ceremonies. So except for the COVID time, which we had a little bit of a time off, we have been awarding 2 DAISY Award ceremonies a month. So to date, we've done 172 ceremonies, and tomorrow's will be our 173rd for a University Hospital PACU nurse. I receive over 400 DAISY nominations per quarter, and we only consider patient and family nominations for the honorary award. We have had 1 leadership award. We had a long time CNO, Marge Clarko, that retired, and we awarded her the leadership award from DAISY, but we weren't able to continue with, we were not able to continue with that, but we are now starting in July, we will be giving out leadership awards. And I think something happened to my presentation.
I think something happened with our dear Janet, and she might have gotten kicked off, but I believe I have your presentation as a backup.
Okay.
We back up our backups around here.
Yeah.
So let me get that.
But 2 of my coworkers are leading that leadership award. So I'm looking forward to seeing how they are going to start that up. And then we have also had about 4 team awards since I've been the DAISY coordinator.
I'm just getting this open for us.
All righty.
Okay. Can you see that okay?
Yes. Yep. Can you move to the next one, please?
Absolutely.
So the awareness campaign that I started to get more nominations included having DAISY posters in all the public areas. So like waiting rooms, common gathering areas all across our institution. We have over 1,000 beds. We have 3 main hospitals. We call it on the hill, and then we have several outpatient facilities around the area. So we made sure that the DAISY posters are in all of those areas. At first we were doing a text campaign, but now it's a QR code, and it sounds like a lot of the other DAISY coordinators are also using that. We put a DAISY magnet on every patient whiteboard. So the over 1,000 beds, each one of them, if there's a whiteboard in the bed, by the bed, then there's a DAISY magnet directing the patients and inviting them to nominate their nurse. We have hard copy DAISY nomination forms in all the public areas and nursing departments. We have online nominations using our internal and external nursing website. We also recognize our honorees in our nursing newsletter that goes out every month from our CNE. And then we also register them on the DAISY website, and we have a showcase in the university hospital cafeteria. And then we also have a daily headlines that come out to all the Michigan Medicine employees, and we try to get the picture and their story out on that website. Next, please. So to my left, that's the DAISY nomination award hard copy form that we have. And then, like I said, we try to get that into all of the areas that have nurses. The middle DAISY is what the magnet looks like that goes on every patient whiteboard. And kind of interesting, we actually even put these in our ER on the whiteboards. And before that, we didn't receive any nominations from our ER, and our ER is like a little city down there. They have a ton of employees, a ton of nurses. We see over 80,000 visits a year. And ever since we added these magnets, I get a lot of great stories from the ER. And then the poster is the last thing on the right. Those are the ones that we put in our public areas. Next. So the selection process, U of M is a little bit different than the other 2 presenters. I am the entire DAISY committee. I review all of the online and written nominations every quarter. I pull those out, and the ones that have really good letters. And then all of the honorees out of the 400, 500 that I get every quarter, I may get like 10 to 15 that have a lot of good meat to it. And I vet them with the current manager. So we, our clinical evaluation of this nurse would include her clinical skills, compassionate care, exemplary service, and her commitment to excellence. And if the manager agrees that she meets those qualities, then I schedule with our CNE, who is Nancy May, for her to go and present the award. So she does all of the presenting. That's her favorite thing, like I've heard the others say, and she always makes herself available for that. I send out an email invitation to the unit management, our ACNOs, our CNOs, I invite Janet, and I also invite Charmin every time. And sometimes Daisy, the regional director or Charmin is able to come. So that's always a real special treat for the unit. And we always have them on the unit so their co-workers can be a part of it. And for the most part, they're so excited for that nurse because they know that that person is a real good exemplary nurse. And we make every attempt for that ceremony to be a surprise also. Okay, next. So the monthly DAISY Award ceremonies, they're on the unit, like I said, with other staff. Nancy reads a nomination letter. She presents the award. One of the recruiters from our office always goes over and assists her with that. We always include in our presentation award bag, a copy of the nomination letter with all the patient identifiers out, but we also include the DAISY book, shining the light on all that's right. We take photos, and then we give the unit maize and blue cupcakes. We had a Cinnabon for many years, and we did used to provide those. Then our Cinnabon closed, and for a couple of years, it was hit and miss on the quality of a Cinnabon, and we've tried all the different bakeries in the area. And then the Cinnabon came back to the mall and they were not reliable. We'd go to pick them up. They didn't have the order. And so it was just a real nightmare, to be honest with you. So we get maize and blue cupcakes for the unit. The nurses absolutely love them and they're very much appreciated. So next slide, please. So here's a couple of pictures of our last 2 awards. The Ed Gallagher on the left, he is one of our pediatric nurses and his wife came to the awards ceremony. We do leave that up to the unit. Sometimes the spouses or family members are invited and sometimes we have patients and families. This kind of depends on the situation. And then the cute nurse on the right is Olivia, and she works on our cardiothoracic unit. Okay, next. Before I go on to the next one, we do also have a banner. You saw it in the pictures that we take pictures by that and I submit it to the DAISY website. And then any pictures that are taken during the ceremony, I give that to the honorees. So the DAISY pin and letter distribution started probably around 2015, 2016 also. When I first took over the program, we were getting these nomination letters and I was just filing them if they weren't selected. So it's like, what can I do with these letters? These patients and families have taken time to write the letter to thank a nurse, but if they're not selected, they're not getting the recognition. And so we developed a quarterly distribution process. So all the nominations that are not selected, I copy them, removing the patient identifiers. I have a thank you card from our CNE, Nancy, and I include a DAISY pin. All the letters and pins are sent to the manager for distribution. They do it like at staff meetings or huddles, where all the staff is present. So they get the co-workers involved in that. And I also, like the other 2 DAISY coordinators, I keep an Excel spreadsheet by department and nurse name to see how, where they are. I have a single DAISY pin, then I have a multi-DAISY pin that has 5 daisies for 5 nominations. Next. And this is just a picture of the postcard from Nancy thanking them for providing exemplary care to our patients, the DAISY pins, and then a DAISY nomination form. And then the one in the very back is what the patient nomination looks like coming from my Outlook. And those are the online nominations. Okay, next. And that's it, if anyone has any questions.
Thank you very much, Gail. Thank you to all the presenters for sharing all of your tips and tricks and things that you do with your program. Did anybody have any questions for the presenters before we go to the breakout session? If you do, please raise your hand using the reaction button. Okay, I'm going to reshare my screen because we have some info about the breakout sessions for us.
It looks like there's one question, Janet. Cindy Miller, maybe? Yeah.
Yes, that's me. I'm new to this. So what happens if you've got your Excel spreadsheet? What happens if your nurse changes departments? I'm just wondering if it would be like an Excel spreadsheet in alphabetical order would be more efficient because people change their units periodically, or why you feel the unit-based spreadsheet is more appropriate for your organization.
I'd be happy to start that, and anybody else can chime in. When we do have somebody that changes to a different unit, we literally put them in, highlight them in red, and cross them out from their current unit, and we move them to wherever their next unit is. And it's just really the only way we can kind of keep track of that. We like knowing who's from what unit. If we keep it in alphabetical order on that unit, but we'll literally cross them off, or if they've left the organization altogether, we totally cross them off. Sometimes there's a little bit of a lag time when we get a nomination and the person may have left already. But we'll just physically move them on the Excel spreadsheet to their new location. It just seems to work fine. We it's a little bit of logistics. You want to make sure you capture it, but it seems to work okay for us. So I don't know if anybody else has other, things that you do, but that seems to work. Did that answer your
Yeah.
question, Cindy?
I was just gonna add, we do a lot of what Madeline does, but because I have over 6,800 nurses at U of M, sometimes it's just really difficult to track who's going where and what unit. So there's times that I don't know that you just recently transferred. So I just go use the unit in alphabetical order from each unit, and then I just start over new. They get they would get another single daisy pin, a copy of the letter, and they would start over in the counting of their nominations from that new unit. And that has seemed to work just fine on my side.
Any other questions? Okay, so we are going to go to our breakout room session. Sorry. Okay, I'm just going to leave it here. Zoom is just not my thing today for some reason, but we have organized 4 separate breakout rooms with different topics to be viewed in each one. And you're not seeing that, are you? Let me see. Okay, can you see the breakout rooms?
Mhm.
Okay, so we've got 4 different breakout rooms, and once the breakout room sessions are open, you'll be able to choose which one you want to be in. And then when it's time to leave the breakout room after 30 minutes, you'll get a pop-up with a blue button that says leave breakout room. So you'll just click on that and you'll go back to the main room. The breakout room sessions are not being recorded, so we hope that you'll turn your camera back on so we can see and hear you. Any questions about the breakout room and what's going to happen before we click it on? Okay, Christina, if you can activate that so we know where we're going.
They should be active. So down at the bottom of your screen, you can click on breakout rooms and you can choose breakout room 1, 2, 3, or 4 to join.
And raise your hand if you're not finding it. And any Daisy staff that is still here, please join any room and participate. Cindy, did you have a question?
I do not have a breakout option.
Should be in the row where you've got mute, stop video, participants, share screen, record. There's 4 little
Thank you.
boxes. Got it?
I see it now. Thank you.
Okay. Anybody else having issues finding that? Okay. Christina, I'm going to go to the room. Can you please help if anybody has an issue? And Mariah, you should be going to breakout room 2. And London, you're in 3.
Yeah, I just went to 3. I wanted to come back here to make sure we weren't having technical issues because we're the only, Bonnie, myself, and Rebecca are the only people in the breakout room.
No. Do you want to just hop in a different room? Because everybody else, pretty much, Ruth and Penna Yoda, if you need, if you can pick a breakout room to go to, we just don't want to leave anybody behind in the main room.
Ruth, I can assign you to a program. It sounds like you're audio only. Do you care which one? I'm happy to put you in whatever room you would like to be in.
Okay, I'm going to go to the room.
And someone put me anywhere. Okay. And our last person here, telehealth is your name. Do you need to be put into a room?
Okay, wonderful. So let's go through our breakout session recap, and we'll talk to each group a little bit to see highlights and some notes that they want to share. So first off, in room 1 was Jackie Park. Jackie, who did you have with you? Madeline?
I had Madeline, yes.
Okay, so if you can give us a little update of what you guys talked about in room 1.
Happy to. So we were in breakout room number 1, which is newly committed programs or first year programs. So some of the topics that we covered today was regarding the DAISY banner and how to hang it in the unit or where your presentation takes place. And some of the difficulties would be having maintenance display the banner in the unit and then having to take it down. So Madeline had a wonderful suggestion of getting a vertical banner, which they currently use for their program. They created their own vertical banner specific to their branding, which we talked about having that as an option using the DAISY Foundation logo. The fact that you can add a QR code and your own logo, the facility logo to these banners, or you could purchase this banner through the DAISY Resource Center. There is a DAISY order form for that. We also discussed for our brand new program that was just launching what the very next steps would be, because they committed just last week. So we talked about the welcome kit to have an overview of the DAISY Award program and to stay organized with DAISY or house DAISY materials and a coordinating checklist. We went into detail about that, as well as receiving your annual invoice. And the next steps would be having the brief introduction call with you, Janet. And we had another question regarding the online nomination form, if their facility had one or what the requirements were. So I went over those options, whether that's the online nomination form being created internally through your IT or marketing departments, or if DAISY can create it for you at no additional cost. So we gave information about that, as well as what to do with the QR code and how to display it on our marketing materials that we have in the Resource Center. So that
Wonderful.
Everything
that sounds like a lively discussion.
It really was.
Thank you so much for that report. Next, we will go to room 2, which was hosted by Alex Schoen. Alex?
Yes, we had a good discussion in breakout room 2. It was for existing partners, so anyone who had had their DAISY program for more than 2 years. We actually mid-conversation when the breakout room started or ended, we did have time to talk about, first, we had a question about appropriate annual award frequency. So kind of the background of why facilities present this certain number of awards that they do and why there may be variance versus quarter. And even just the difference, if one facility might present 1 DAISY award per quarter for 4 awards per year, that is smaller in size, but a larger hospital presenting 12 awards per year may still present quarterly. It just might be 3 awards at the end of each quarter. We had a long conversation about tracking nomination stories. We talked about alphabetical lists, or if it was by unit, tracking individuals who are nominated multiple times, individuals who'd received the DAISY award multiple times. We also talked about the sample tracking spreadsheet that is available in the Resource Center. So if anyone is looking to switch up that process or to begin tracking moving forward, we do have kind of a starting point available for you in the Resource Center. We also talked about marketing and how people were marketing their award program, especially in regards to the post or the changes that COVID brought, marketing tools that maybe were in existence that were then removed, how to begin marketing the award program again. One wonderful suggestion from Sammy, who is in our breakout room, is that her organization is using Stickles, STICKLES. They are able to be posted onto the wall. They look like paint and they will stay there. They can be wiped down in the sense of being quality approved. So that was a wonderful suggestion for another partner who is experiencing issues with being able to get patient room or marketing within the patient room. So that was a wonderful idea that not many of us had heard of that we wanted to share. And then we were kind of middle of the conversation when we came back to the breakout room. So anyone else within room 2, please feel free to bring up any additional questions at the end of the presentation today as well.
Thank you so much, Alex. Now on to room 3, where we had specialty and non-traditional DAISY programs. Bonnie in London, do you have some things to share?
Yes, thank you, Janet. As you mentioned, Bonnie and I were assigned to room 3 for specialty programs. Rebecca also joined. We had a pretty small group. Ruth joined our room. So it was Rebecca, Bonnie, Ruth, and myself. We discussed generating more nominations in the emergency department. With that, we talked about best practices. We discussed some of our signage with the QR codes. We also discussed the business cards. Along with that, I'm sorry, give me 1 second. Along with that, Ruth did mention that they are bringing in 60 nominations quarterly, and we think that is a huge deal. We also discussed having annual check-ins or meetings with the DAISY program manager or director, as that's very important to staying updated with the program and making sure that the nominations are steadily coming in, and to make sure that we hold on to the integrity of DAISY by hosting the appropriate amount of ceremonies. And I believe that that would be about it. That's all I have to share. Thank you. Back to you, Janet.
Thank you. Bonnie, did you have anything to add from that discussion?
Only that it was interesting to me to hear Ruth talking about some of the challenges that she has with getting things accomplished and delegating members of the committee to do stuff. So Janet, I know London's going to reach out to you to please follow up with Ruth and kind of walk her through a webinar now on how to happen with the committee as well.
Absolutely.
And encouraging her to find a marketing person to bring to that meeting.
Great idea.
Yeah,
I was just at Ruth's hospital this morning for a medical visit. So.
Oh, really? Well, she was very forthcoming about where she needs some help. So I know you will.
Absolutely. I'll follow up with her. I will make a note to do that. Thank you so much. And I had breakout room number 4. We talked about expanding our DAISY Award programs. We had a small but mighty group of 5 people in the room. We talked about all of the other ways that you can celebrate nurses besides the regular DAISY Award program, including anywhere from nursing students all the way up to lifetime achievement at retirement. So wherever you're at in your career, we want to be there to celebrate and acknowledge you. So we talked about our DAISY Team Award, the Nurse Leader Award, our Health Equity Award, the Nursing Ethics Award, and also our academic programs. And we had a few questions here and there about implementation and how you would operationalize that. And then toward the end of the conversation, we started talking about how do you keep your awareness fresh in different environments. So June is from a smaller home health group. She's from Health Call, versus Gail, who was in a large medical center. So they were making suggestions about, placing your nominations in the patient folder that goes to the home at the beginning. And from what I gathered from the discussion, that folder is addressed weekly when the nurse is there. Is that true, June? So it is seen pretty frequently.
Yes.
So that was a great way of keeping it fresh.
They do charting in there and everything. So it's in a pocket in there. They have access to it.
Thank you. And she talked about, the nominations that come in from it's people who are getting home care, some of them very long term. So those stories are very heart-wrenching and, sometimes very hard to choose who that honoree is going to be because the stories are so heartwarming. So that was kind of an overview of what we talked about. Does anybody have any questions about anything overall that you heard today? Anything that you talked about in the great breakout room? Anything that we can expand on for you? Just raise your hand if you have a question. I don't see any hands going up.
Janet, I have a question for the group.
Yes, ma'am.
Is everyone aware that we collect nominations for you on our website? That you, if we have given you a URL that we've created for you or a QR code, there may be nominations that are in our system for you that you can access. Do you all know about that?
Hi, it's Sammy. Yes, we appreciate that so much that there's online nominations. I actually kind of have a question, I guess, for the group. Sometimes we'll get nominations online from families and they'll put the one nurse's name down and then they'll list like 8 or 10 other nurses. And then you're having to kind of read through the story and pull out, okay, who really is the nominee and whatnot. And I just wondered how people handled those. We try, if they're nominated, we give them a nomination pin, but we're not able to, because we just do the individual awards. Occasionally we can do a pair of folks in a month, but we're not able to, you know, honor like 8 to 10 people. So just curious.
Such a great question.
Handle that.
That is a great question that I just addressed last week with somebody, because they had a nomination where they mentioned 4 nurses. And luckily for this situation, in the nomination itself, they had a paragraph about each nurse. So I told them, copy it to the next line and put each nurse with their own part of the story. So it's an individual nomination, and that worked out. However, the flip side of that is if they name 8 people and don't call them out in the nomination, I would just do as you did, give them each a nomination pin, and it's the story as it is, because they didn't really specify, you know, who did what. So it makes it a little difficult. Or you could always go back to the patient and ask them to expand on the story. See, do you have anything you can share individually about each nurse so that we can acknowledge them, each one? So, and I have had people do that and it's worked out very well. Does anybody else in the group have a suggestion?
Yeah, Sammy, one of the things that, you know, that we'll do too is we'll try to recognize each of those nurses that was mentioned. But if the patient, sometimes they'll include nurses and then they'll say something about the doc and then they'll say something about the physical therapist, and, you know, they kind of clump a bunch of people. What we do is we'll recognize the entire staff that month. It's not the Daisy Team Awards specifically, but sometimes we'll take and we'll give out a certificate for the entire unit. And they don't all get pins, but we do recognize the entire staff of, you know, labor and delivery, because there's so many different people that are listed in there, and it's almost like the whole team. So if it's just nurses that they talk about, we'll recognize those nurses separately. They'll each get a certificate and a pin. But if they start pulling in other members of the team, then we kind of turn that into a monthly staff recognition. So that kind of works, because sometimes that's what you'll see. You'll get a bunch of people listed in there too. So, which is great, because then they had a great experience with everybody. But we can't forward it to the physical therapist and the physician and whatever. So we just make it a whole team award.
That's a great idea. Thank you for sharing that. Now, along the lines of those online nominations, Bonnie, thank you for bringing that up. Now, when I do a 6-month check-in with my Daisy coordinators, I'm putting that in my message to you saying, are you aware you have these nominations? And I look to see if there are nominations in there and let you know there are currently nominations. If you need help exporting them, please let me know and I'll be happy to walk you through the process. So if you're not sure if you have an online nomination or you want more information about that, please contact me, email or phone, and let me know, and I'll be happy to walk you through the whole process. I also just last week worked with another Daisy coordinator from Indiana, and we put together some training materials for the online nomination form. So that will be able to be shared with you very soon. We give you the process of how to export those nominations, how to structure your Excel spreadsheet, and then how to, if you want to do a mail merge. So if you've got all those certificates, you can merge your Excel spreadsheet with a form, with your certificate form, and just get one file that has 40 nominations to print out. So we can walk you through the whole process to streamline that and make it easier for you. So that's in the works. That will be coming your way soon. Thank you, Christina. Put my email address in the chat. Any other questions that we can address for you today, or any comments you'd like to share? I hope this was helpful. I really enjoyed being part of this with all of you today. Okay, well, thank you so much for your time today, for joining us. We will be following up with you. I wanted to especially share and thank my co-presenters today, all of my DAISY colleagues. I want to try and share my last screen here. Sorry. Just thanking all of you for being part of our day today and our session. And of course, it's going to make me go through it all again. Get to the last screen. There we go. So thank you to all of our wonderful presenters, Madeline Tarakis, Gail York, Mariah Haas. Thank you to all my DAISY colleagues who took the time to be with us today. Your participation in our program means the world to us. And I know that it means the world to your nurses. Just having somebody say, thank you for making my journey easier means a lot, and sometimes gives you the wherewithal to keep doing that job a little longer. So thank you all for being here. We will follow up with the recording information and PowerPoints that were shared today. And if you need anything at all, feel free to reach out to me. That's what we're here for, to make your job easier. So have a wonderful day.
Bye, everyone.
Bye.
Thank you.
Thank you.
Bye. Thank you. Us. Take care, everyone.